Okay, so now I'm recording. So we went over Bulla. I'm going to go back. So this one is a Bulla, B-U-L-L-A. This one is a cyst, C-Y-S-T. This one is a macule, M-A-C-U-L-E. And this one is a nodule, N-O-D-U-L-E. So now that I remembered to record, we can move on. Okay. This one, we talked about this in the last lecture. The fancy word for pimple is papule. Okay, papule. It's a small elevation in the skin. It doesn't really have a ton of liquid in it, but it could develop pus. That's that satisfying, again, pop that you get when you have like a small, reasonable, not crazy pimple, okay, like a whitehead. However, if it becomes raised and inflamed, like it is right here, we graduate to a pustule. We talked about that last lecture as well. So that's when it's becoming infected. We have redness, we have inflammation. Those are signs of infection. It might feel a little warm to the touch compared to the rest of your skin, also sign of infection. And it's going to be filled with pus. So it'll look white, maybe even yellow in the middle because it's not great, okay? Last one, abnormal cell mass is a tumor. A tumor is any abnormal skin mass, any abnormal mass that varies in size, shape, and color. It's not always cancer, nor is it always cancerous. A little rhyme to remember, benign is fine. If you have a benign tumor, it's more of a cosmetic irritation, or it can be. Malignant is when it's typically cancerous or hazardous to your health. Benign is fine. That's a nice way. Not always fine, but it's not cancerous. Okay, moving on. If I could get this thing to click appropriately. There we go. Guys, why won't this work? No one can answer me, but I don't know why it won't work. Okay. More primary lesions of the skin. We have small blister with clear fluid. This is important to differentiate between like a pustule or a papule or what we're about to talk about right now. It's filled with clear fluid that's not pus or infected, and that is a vesicle. Okay, it's like a small blister or a sac containing fluid that lies just under the epidermis. And like we talked about last week, we have the epidermis and then the dermis. Here we go. So the epidermis has the 5 layers that all start with stratum, and the dermis has the 2 layers, okay, reticular and papillary on the underneath, and then we have the adipose tissue. So in between the epidermis and the dermis are where we'll find vesicles being. They require medical referrals and diagnosis because the cause of them is unknown, and a lot of times they're not treatable with like over-the-counter stuff. So like acne meds won't do anything, things like that. They're not gonna touch what's going on with a vesicle. So they'll either need to be drained by a dermatologist or a physician, okay? The next one is a wheal, just like a car wheel. Itchy, swollen lesions. So those are like hives. If you have an allergic reaction to something, you can end up with a wheal. A bug bite would be a wheal. An allergy gives you a wheal. It's hives, okay? Itchy, irritated, but not permanent, not chronic. Okay, it'll go away. Speaking of going away, I want this next slide to go. There we go. Go. Nope, I'm just drawing. There we go. Secondary lesions, these are ones you're not gonna see as often, but you will see them. It's likely you will see them, so it's good to know. The first one we're going to talk about is dead cells formed over a wound, is a crust, or a scab. Basically, think of a scab. So it's dead cells that form over a wound or some kind of injury while it's healing. And it's a combination of dead skin, sebum from our sebaceous glands, sometimes pus, depending, and cells from the epidermis. Those are the dead skin cells. Okay, it's a I just said it. Scab. That's where we're at today. I can't remember words I just said. So the next one is excoriation, which is a skin sore or an abrasion, and it's caused by scratching or scraping. So if you get it's a brush burn. Fancy word for brush burn. If you skin your knee, you have an excoriation on your knee, which will then crust over, creating a scab. So if we're going to be really fancy, you have an excoriation, which to heal forms a crust. But in real life, you have skinned your knee, so you have a brush burn, and it's going to get completely covered up by a scab. Okay. And now we have a crack in the skin is called a fissure. So fissures, to be a fissure, it has to go all the way through the epidermis to the dermis. It's not just casual dry skin or anything. A fissure is pretty deep. Cool. And here we go. Next set of secondary lesions are a thick scar is called a keloid. Okay, it's thick because it's an excessive growth of tissue, and people are typically susceptible to them. So not everyone that gets hurt or forms a scar will get a keloid scar, but there are people that are more susceptible to having them. Okay. Then we have a thin plate of epidermal flakes is a scale. This could be like your common dandruff. It's thin, dry, and oily, which it's weird that it can be dry and oily at the same time. It's a dry piece of skin that flakes off with excessive oil. Okay. So a scar or a cicatrix. Cicatrix is the fancy word for scar. Light color, raised mark on the skin. Most of us have seen or have a scar that they can refer to that would look like this. It's very easy to identify. It's a scar that's healed. And lastly on this page, we have an ulcer. An ulcer is an open lesion with pus. It's gross, okay? Open lesion of the skin or in the mucous membrane of the body. So it can be like in your mouth. And it's accompanied by a loss of skin depth. So your skin is really thin, and it can do what's called weeping. And when something is weeping, it's essentially trying to clean itself by just oozing fluid and pus, trying to get rid of the infection. Absolutely requires a medical diagnosis. You should not touch them. You should go nowhere near them. And in no circumstance should any products be put onto an ulcer, okay? Because not only is it not safe for you, it is absolutely not safe for the person who has the ulcer. Cool. Gross. Okay. Moving on. So we talked about some people, comedones, that's a common way to say this. They can be open or closed, so this is a little bit of a review from last week. With the sebaceous glands, which are oil glands, if you have an open comedone, it's getting oxygen into it and it's turning black. The contents will turn black, and that's how you get a blackhead. Closed means the skin is over the top of the opening, causing it to be closed, and keeps it away from the oxygen and causes a whitehead. Milia are benign. There's that word. Benign is fine. Benign keratin-filled cysts. So they're filled with keratin, which is what makes up our hair, skin, and nails. And it appears just under the epidermis, just ever so slightly, and they don't have any visible opening. And you usually have a bunch of little ones together. They look like pimples, but they're wildly small. Okay, they look like little itty bitty sesame seeds. And they are poppable, but you really shouldn't pop them or try to get rid of them without the help of an esthetician at the very least. Acne, common pimples or papules, if they get red and inflamed, they're pustules, keep that in mind. But it's chronic inflammation of the sebaceous glands. Cool, that have bacteria mixing in with those oils to cause breakouts. Awesome. If you have a sebaceous cyst, we just talked about what a cyst is. It's a large protruding pocket-like lesion filled with sebum. Sebaceous glands leach sebum, therefore they're filled with sebum. Sebaceous cysts are commonly, you can find them on your scalp, and sometimes on your back, and they need to be removed surgically. That sebaceous cyst, Dr. Pimple Popper for sure, right? Again, should never be popped on your own if you have one. They're not going to, if they're not open or burst, you're pretty safe to move forward with service. But if they are open or weeping, so they're leaching that sebum out, don't recommend that they see a doctor and deny service. Seborrheic, that's how that's pronounced, seborrheic dermatitis is the inflammation of the sebaceous glands. Okay, so that's like acne for your sebaceous glands, the inflammation. It's often like you have dry, oily skin, crusting, itchiness. So if anyone has ever gotten close enough to me during the school year, you can see I have it on my forehead. It's kind of going away now because I'm not as stressed out. But I would have it right here where it would be red and kind of flaky and dry. That's seborrheic dermatitis. It's really often found in the eyebrows, the scalp hairline, middle of the forehead where I have it, and along the sides of the nose right here, which I also get. So this is, if you know, when I'm having a really bad no makeup day, you can see it full blown. And usually you just use topical ointments to keep it under control. Lastly, rosacea is the picture on your slide, which if you have it in black and white, it's not going to help you, but it's a chronic inflammatory congestion of the cheeks and nose. So your skin's a little bit inflamed, causing it to be red. And the formation of papules and pustules can show up. So rosacea can be accompanied with a little bit of acne and some pimples. Excuse me. And you can have rosacea that's aggravated by certain things like foods, caffeine, alcohol. If you're out in the sun too long, it can come through. So there's quite a few different factors when it comes to dealing with rosacea. Next slide. So a lack of perspiration. We're going to talk about the sudoriferous glands, which are our sweat glands. Lack of perspiration is anhidrosis. Okay, that's supposed to be one word, anhidrosis. Okay, that's a deficiency where you have no ability to sweat, which is actually really not good for you. It can be totally life-threatening how when we sweat, we're regulating our body temperature. You can overheat very easily. But anhidrosis, no perspiration, okay? Anti-sweat, anhidrosis. So if we have really bad smelling sweat, that's bromidrosis. The way we can remember that, bromidrosis starts with a B. BO is bad body odor, okay, B and B. So the foul smelling sweat is typically just in the armpits or the feet, and it's caused by a bacteria. And if you have a severe case, which people do, it can be treated by a doctor. Excessive perspiration would be hyperhidrosis, where we have an overabundance of perspiration. Hi, little Lewin. Do you want to say hi? real quick. Hi, everybody. Little baby. You gonna go have your baba? Yeah, okay. Sorry. Thank you. Hyperhidrosis, excessive perspiration. It's a ton. You just cannot stop sweating, even if you're cold. It's caused by general, like your heat and also body weakness, just generally being sick. If you have autoimmune diseases, this could come along with it as a side effect, but it does require a medical referral. Malaria, wait, not malaria. Miliaria rubra is also called prickly heat. Prickly heat is an inflammatory disorder. It's characterized by like a bunch of red vesicles popping up, and it burns and it itches. So it's heat rash. So if you've ever been out in the heat too long, or I don't know, sometimes like when I was younger, we didn't have air conditioning and I would sleep like this, and in the little crook of my arm here, I'd get like a heat rash from it being so hot, and it's like a prickly, burny, itchy, bumpy thing. It's temporary and it does go away, but it does show up, and that's what that is. I think I finally figured, the second I say I finally figured out how to do this, and it just doesn't work. Huh. Okay. Conjunctivitis is a fancy way of saying pink eye. I know there are a couple movies that make fun of conjunctivitis and pink eye because it really is a bacterial infection from the eyes. It's super contagious, and you can get it if you have fecal matter in your eyes. That's like where the joke comes from. But it's super, super contagious. If you itch your eye and then touch something else, someone comes along and touches that, they can easily contract conjunctivitis. You have to go to a doctor, and you have to like kind of get rid of everything that's touched your eyes. I know that sounds silly, but if you sleep with a sleep mask on, you should wash your glasses if you're a glasses wearer, things like that. And obviously not touch your eyes. And I think what this whole COVID-19 thing has taught us is wash your hands and don't touch your face. There you go. Dermatitis is an inflammatory skin condition. It's very broad. So like you can have anything, and if your skin is inflamed, you have dermatitis, essentially. It could be something else, but dermatitis is like the catch-all. And it's typically temporary. Eczema is acute chronic lesions. So chronic, again, meaning we cannot get rid of it. You can have eczema that is inflammatory, like it's all swollen. That's what that picture is eczema, which could also be diagnosed as dermatitis because it's the catch-all. But it's a chronic disease, so it's not really going to go away, but you can help the effects like with lotions, topical creams. But it's typically characterized by scaling, and it's really itchy and red. So other inflammatory conditions of the skin, we have herpes simplex, which is a fever blister. It's a recurring viral infection, and it could come up as a cold sore too. Characterized by the eruption of typically a single vesicle. Remember, we're using the technical terms. Vesicle, and it's red at the base of it, kind of like we talked about a pustule. We have a vesicle that's red at the base. And it's usually on the lips, the nostrils, or other parts of the face, and it can linger for 3 weeks. Impetigo is weeping lesions. We talked about that weeping, right? When it just leaches out what it's trying to get rid of. They're usually caused by staph bacteria, Staphylococcus bacteria. And it typically occurs on the face around your nose, typically. And it can be seen in children, but children are most common to have it, from what I understand. Although you can get it at any time, but I think that's kind of like that hand, foot, and mouth stuff. And psoriasis is common chronic inflammatory skin disease. It's very similar to eczema, except it's a little bit more elevated in the sense that it has like these silvery white scales of skin that get shed and sloughed off regularly. And it's typically found all over the body. So scalp, elbows, knees, chest, lower back. Psoriasis is not typically found on the face. Dermatitis might be on the face. Seborrheic dermatitis is on the face. Psoriasis is not going to be on the face. It's going to be your body, okay? You can have more than one. You can have seborrheic dermatitis and psoriasis and eczema. They're all a little different. But if you have one, you very well could have the other or another. It is not contagious at all, but it is chronic in the sense that it is not curable, but it is treatable. So we can try and manage the symptoms like the itching and things like that. Okay, now we're on to pigment disorders of the skin. So we have hyperpigmentation, which when we talked about sweating, hyper meaning excessive, okay? Hyperpigmentation is when you have darker than normal pigmentation in splotches. It's not your whole body, that would just be your pigment. But if I had a big old spot on my face, this part would be hyperpigmented, extra pigmentation, more pigmentation. Now, obviously, the next one is hypo, or a lack of absence of pigment. So you might have a white spot, okay? Albinism is a congenital hypopigmentation. Congenital means you're born with it. Hypopigmentation means, we just talked about it, lack of pigment, absence of melanin. And that means you have no melanin in your hair, your skin, your eyes, or the iris of your eyes. Your skin will not tan, your hair will not take hair color. Some people have a patch of hypopigmentation on their scalp and it causes their hair to not have color. If you color their hair, that part will not hold color. Fascinating. Your eyes are typically pink because there's no color in the iris of your eye. Chloasma is a condition characterized by hyperpigmentation. So now we're going the opposite way, in spots on your body, kind of like freckles, but not really, if you think of it that way. They're generally caused by cumulative sun exposure. So chloasma, typically caused by sun exposure, okay? Chloasma can also show up in pregnancy, and people end up having it on their face right here. It's called the pregnancy mask or mask of pregnancy. It'll go away, okay? Lentigines, those are freckles. That's the fancy word for freckles. That's all you need to know. Leukoderma, we've talked about that leuko before, that prefix in Latin being white. So that's a skin disorder characterized by light patches of skin or white patches of skin. Also hypopigmentation. That can be caused by injury, like a burn, a scar, or a congenital disease, born with it. Congenital, born with it, disease that destroys the pigment in the cells. And a nevus is a birthmark, fancy word for a birthmark. So it's a big malformation of the pigmentation in the skin. So a nevus, birthmark. Lentigines, freckles. Those are the two that are like easy to remember. So then we have more, there's stains, which is just abnormal brown or red patches on the skin that don't go away, typically in a regular shape. You're seeing a picture of a stain right now, and it comes with aging. You can get them with certain diseases too, but typically, I don't know of many diseases that one of the things is stains. But I don't know. But that's what it would look like on the skin, is in that picture. I'm pointing to the one on my screen. I don't know if it's in the same spot on your screen. A tan, change in the pigment of the skin, deepens the color. We all know what a tan is. And vitiligo is a hereditary condition which causes hypo, again, lack of pigmentation in spots on the skin and in splotches. There's that one really famous model, I don't remember her name, Winnie something. Winnie, beautiful girl, and she has very dark skin, and she has white patches on her face. She's very famous, very, very, very pretty, but that's vitiligo. Okay. Moving on, hypertrophies of the skin, hypertrophies are abnormal growths, most of which are benign. Benign is fine. So we have a keratoma, which is a callus, okay, fancy word for callus, which we talked about are caused by pressure. We talked about that last week. A mole is a small brown spot or blemish. I have one, boom, wait, oh my God, wrong arm, mole. It's a small brownish spot on the skin, very easy. Skin tag, small brown or flesh colored outgrowth of the skin, typically very small, and they most commonly occur on the neck right here. So if you're cutting someone's hair and they tilt down, you might see one. They're totally harmless. And a verruca is the fancy term for a wart. So there's that. So let's, for a quick second, there are different types of skin cancer we have to talk about. So there's basal cell, squamous cell, or malignant, and they're all melanomas or carcinomas. So basal cell carcinoma is the super most common and least severe form of skin cancer, which is the first picture. Light, like pearly nodules, so they almost look like little pearls on the skin. It has a 90% survival rate. It's very, very common, basal cell carcinoma, okay? Squamous or squamous, depending on where you live in America, cell carcinoma is more serious, so it's a step up from basal cell carcinoma, and it's scalier, so it's the second picture. Survival rate depends on the stage of diagnosis, so it is more severe than basal cell, but again, still pretty survivable as long as you catch it. So you should take anything that looks like that seriously, and we're gonna talk about what constitutes what you should go to a doctor for. Lastly, a malignant melanoma, we just talked about the word malignant, benign is fine, malignant is not, is the least common type of skin cancer, but if you leave it alone and don't get it checked out, where it's, see how it's black, that's how you're gonna know that something is really wrong, it can be super fatal quickly. Mainly because if the melanoma travels and it attaches to your lymph nodes, it'll spread throughout your entire body. But if you get it checked, you will absolutely be okay. Well, I shouldn't say absolutely, but you have a better chance of being okay. So the ABCDE cancer checklist, here we go. What we're gonna look for when we're looking at existing moles or changes in your skin, these are going to be what you're looking for if you're checking it for cancer specifically. So if you have asymmetry, so if you have a mole or a growth on your skin that all of a sudden is morphing into something not symmetrical, that's not normal and it's not typical, so it should be checked out. B, being border. The border of the mole or whatever you're looking at, whatever you're trying to check, should be clear. Should be very clean cut, like where the change is. If it's really fuzzy or if it's not, if it's really wobbly, the line of it is really wobbly, that's not a clean border, it should be checked. Color is C, color. Any changes in colors, if you have a mole, say like I have a mole, if you have a mole that suddenly is getting darker and darker and darker and darker out of nowhere and you don't know why, that's a change in color. You need to be aware and maybe get it checked. D, being diameter. So if something is spreading out, if it's getting bigger, absolutely something to take note of. And E, being evolving. So really if it's changing. Anything that's changing regularly, I would take note of it. So we're looking for changes in symmetry, border, color, diameter, and evolving. A, B, C, D, E. Okay? A, B, C, D, E. Retention hyperkeratosis. That is a hereditary tendency for acne-prone skin to retain the dead skin cells in the follicle, okay? And it's going to clog the follicles, and it's going to make the swelling and inflammation much, much worse, okay? So then we go from having acne, which isn't fun to begin with, to having severe papules, severe pustules, and lesions all on our face, all while it's red and inflamed. So what happens with acne is if it starts retaining the retention keratosis, if it goes to that stage, it's going to get worse, okay? Still needs to be diagnosed by a doctor. Propionibacterium acnes, okay, is anaerobic. So anaerobic means it suffocates when there's no oxygen, it can't live. We are anaerobic. But when the follicles are obstructed and the oxygen is blocked from the bottom of the follicle, it allows the bacteria to multiply, okay? So the bacteria start multiplying, and it causes more inflammation and swelling in the skin and in the follicle, and it'll eventually rupture the follicle. It's not good. You don't need to know that fancy pants word, okay? Acne papule, and a papule, fancy word for a pimple. Now we're putting it with acne, very simple to understand, and it just keeps accumulating. It's like acne papules, pretty bad, pretty severe. Clicking. Acne treatments are cleansers and toners for oily skin specifically, okay? Follicle exfoliants, you want to get any of the cell buildup out, allowing oxygen into the skin, and that'll help kill the bacteria. Common things are like salicylic acid, hydroxy acid, acids, benzoyl, what is that? Benzoyl peroxide. Those are all good to use as follicle exfoliants. You don't want to use anything too fatty or oily because it'll clog the pores, and use a lighter moisturizer, again, because we want oxygen to get into the skin. So we have what are called intrinsic factors, okay? Intrinsic factors are all about skin aging. We have no control, very little control over intrinsic factors. They deal with your genetics, your ethnicity. Gravity is going to take a toll on your skin. You have no control over that, except you can use creams and things like that to try and prevent it, but it's inevitable that your skin will eventually sag due to gravity. And your facial expressions, so smile lines, crow's feet, things like that, they're going to happen unless you are going to freeze your face, never smile, only drink through a straw, and have absolutely no happiness in your life. That's what's going to happen. You're going to get those lines. So extrinsic factors are environmental factors. Extrinsic happening outside, okay? Intrinsic kind of inside. They're part of being human. Did I spell that right? Yeah. So sun exposure, smoking, overuse of alcohol, smoking and drinking together, stress, poor nutrition, and pollution. These are things we do have control over exposing ourselves to. Intrinsic, we have very little control. Extrinsic, we have much more control, okay? Extrinsic is responsible for way more aging than the intrinsic factors. Extrinsic factors are probably 85% of what ages our skin. And you have control over them, especially like drinking water. That goes with poor nutrition. We discussed last week that water is super good for your skin and wildly necessary. Mouse. Oh, it's working. Yay. Like I just said, this one, 80 to 85%. Oh, no. Oh, wait. Right as I said, I had it down. There we go. 80 to 85% of aging is caused by the sun's rays, which is an extrinsic factor. You can stay out of the sun. You have that capability. The sun gives off UVA rays, okay, and UVB. Oop. Okay, UVA is going to weaken the collagen and elastin in our skin, causing wrinkles and sagginess. And the UVB are what actually cause sunburn and tanning. The way you can remember this, UVA causes aging. They both cause aging, but this, with the collagen and elastin, UVB causes burning. Burning. UVB is tan. When you get tan, it's a UVB ray. And when you get sunburned, it's UVB. We're almost done. Oh, that's my sister's dog, not my dog. Eloise. Thank you.
You want her in there?
No, I don't. The baby already made an appearance. Yeah. Okay, so to protect yourself from the sun, you're going to avoid deliberate exposure, avoid prolonged exposure, use sunscreen. These are obvious. We've been talking about these our whole lives. That's how you avoid sunburn from UVB rays. We also are going to recognize contact dermatitis. Talked about dermatitis, inflammation of the skin. Two ways we get dermatitis. We have allergic contact, so you touch something you're allergic to and your skin blows up. That's allergic contact dermatitis. You have to touch it. You have to touch it in order for your skin to react. The other one is irritant dermatitis. Okay, so you touch something that irritates your skin or you're allergic to it. Very straightforward. Okay, so then we have this is more specific about the allergic part. It's very easy. It's caused by when you have an allergic reaction to an ingredient or product. Personally, I have an allergic reaction if I use Snuggle fabric softener. My skin gets itchy and irritated. If I don't use it, I don't have that problem. But sensitization, allergic reaction created by repeated exposure to a chemical or substance. This can happen in a salon. If you are using a hair color that irritates your skin, or it doesn't start out by irritating your skin, but repeated exposure, so you're rinsing it out of a client's hair 6 times a day, 5 days a week, 52 weeks a year, you can build up, it's the opposite. Instead of building up immunity, you actually start to have a reaction to it. You'll have to switch products. And commonly it'll show up on places you touch things. So like your fingers, your palms, your hands, and then if you touch your face, like your cheeks, things like that. Irritant contact dermatitis is when irritating substances damage your epidermis, your skin temporarily. Like if you dip your hand in pure bleach and it burns and your skin turns red. That is going to be irritant contact dermatitis. It will go away. You can clearly avoid it by wearing gloves, okay? So you're not deliberately, you're touching something intended to be corrosive, and all of a sudden it irritates your skin. Obviously, you just stuck your hand in bleach. So that would be irritant contact dermatitis. And easy to protect yourself, wear gloves, keep your surroundings clean, PPE, personal protective equipment. That would be like your gloves and things like that. You're going to keep your hands clean and moisturized. Very easy to avoid sticking your hand straight in bleach or something like that. And then we're in summary review, which you guys usually go over independently. So I'm not going to go over it right now, but does anyone, I'm going to turn my screen share off. Anyone have any questions? I tried to make it much quicker than last time, coming in under an hour. Yay. And guest appearances, no less, from a dog and a baby. Okay, so we'll cut it off here. but I will have office hours tomorrow from 1 to 2, same time. If you have any questions while you're doing work, if you just want to say hi, I will post everything in Schoology tomorrow. Cool?
Yep.
All right. Bye, everybody. Have a nice day.